Bismillahirrahmanirrahim. Quote for today is, and your Lord has said, pray unto me and I will hear your prayers. Today, the topic of my presentation is types and steps of evaluation under the supervision of my professor, Dr. Saira Afzal. Learning outlines, introduction of evaluation, types of evaluation and explanation, steps of evaluation, importance of these steps, and recent advances. Learning outcomes. At the end of this presentation, participants will be able to describe about the types and steps that are involved in the process of evaluation. Introduction. Healthcare evaluation is the critical assessment through rigorous processes of an aspect of healthcare to assess whether it fulfills its objectives or not. Aspects of healthcare which can be assessed include effectiveness, the benefit of healthcare measured by improvements in health. Evaluation provides a systematic method to study a program, a practice, intervention, or initiative to understand how well it achieves its goals. Evaluations help determine what works well and what could be improved in a program or initiative. Importance of evaluation is, while evaluation comes in many shapes and sizes, its key purpose is to help us to provide a deeper understanding of how best to improve healthcare. Evaluation is an essential part of quality improvement, and when done well, it can help solve problems, inform decision making, and build knowledge. Monitoring and evaluation are processes that help improve project and organizational performances so that you can achieve the results you want. The monitoring piece of monitoring and evaluation provides detailed information on assessed activities and where improvements can be made. Miring evaluation, there are utilization of resources, costs, and patient preferences. Utilization resources are like utilization of hospital admissions, emergency room visits, physician clinic visits, length of stay, inpatient bed stay, days, asthma inpatient admits, asthma inpatient bed days, asthma ER visits, urgent care visits, scheduled physician or clinic visits, annual rate of food-related hospitalizations, a number of heart failure clinical visits, ophthalmology visits, diabetes specialty clinic visits, and many others. Cost that is included in evaluation are overall healthcare cost, detailed financial performance measures, medical cost savings, projected cost savings, and cost for hospitalization and ER visits. While the level of patient satisfaction is checked as program satisfaction, perception of migraine management, patient satisfaction with care, and many others. Types of evaluation. These are following types of evaluation: formative evaluation, process or implementation evaluation, outcome or effectiveness evaluation, and fourth is impact evaluation. Now coming towards the process evaluation. Process evaluation determines whether program activities have been implemented as intended and resulted in certain outputs. You may conduct process evaluation periodically throughout the life of your program and start by reviewing the activities and output components of the logic models. Process evaluation, results of process evaluation will strengthen your ability to report on your program and use information to improve future activities. It allows you to track program information that is related to who, what, when, and where, like questions. For example, to whom did you direct program efforts? What has your program done? When did your program activities take place? Where did your program activities take place? What are the barriers or facilitators to implement that are in the way of implementing a program activity? Uses of process evaluation as soon as program implementation begins and during operation of an existing program. But it shows how well a program is working, the extent to which the program is being implemented as designed, and whether the program is accessible or acceptable to its target population. Why this step is useful? It provides an early warning for any problem that may occur. It allows programs to monitor how well their program plans and activities are working. It is important to note that usefulness of conducting a process evaluation while you are implementing outcome evaluation. If outcome evaluation shows that program did not produce the expected result, it may be due to implementation issues. Therefore, it is recommended that if you conduct outcome evaluation, you also implement process evaluation. Outcome evaluation. It measures program effect in the target population by assessing the progress in the outcomes that the program is to address. That is to design an outcome evaluation, begin with the review of the outcome component of your logic model. It is on the right side, like being forward. Some questions you may address with an outcome evaluation that may include, like, were medical providers who received intensive STD training more likely to be effectively counseled, screen, and treat patients than those who did not? Did the implementation of STD counseling in a community-based organization result in changes in knowledge, attitude, skills among the members of target population? Did the programs have any unintended, like beneficial or adverse effects on the target population? And another question is, do the benefits of STD activity justify a continued allocation of resources? Now, when to use this type of valuation? After the program has been made, contact with at least one person or group in the target population. What it shows that the degree to which a program is having an effect on the target population's behavior, and why it is useful, because it tells whether the program is being effective in meeting its objectives or not. Formative evaluation. This type ensures that a program or program activity is feasible, appropriate, and acceptable before it is fully implemented. It is usually conducted when a new program or activity is being developed or when an existing one is being adapted or modified. Now, when to use formative evaluation? During the development of a new program, and when an existing program is being modified or is being used in a new setting or with a new population, whether the proposed program elements are likely to be needed, understood, and accepted by the population you want to reach, and the extent to which an evaluation is possible based on the goals and objectives. Now, what formative evaluation shows? It shows whether the proposed program elements are likely to be needed, understood, and accepted by the population you want to reach. The extent to which an evaluation is possible based on the goals and objectives. And why it is useful? Because it allows for the modifications to be made to the plan before full implementation begins. It maximizes the likelihood that program will succeed or not. And last is the impact evaluation. This type assesses program effectiveness in achieving its ultimate goals. When to use this type of evaluation? During the operation of an existing program at an appropriate interval and at the end of a program. And why it is useful? Because it provides evidence for use in policy and funding decisions. What it shows? It shows the degree to which the program meets its ultimate goals on an overall rate of STD transmission. How much has the program X decreased the morbidity of an STD beyond the study population? Now, coming towards the steps of evaluation, there are 10 basic steps in the process of evaluation. First is to clarify what is to be evaluated. Second is engage stakeholders. Third is assess resources and evaluability. Fourth is to determine your evaluation questions. Fifth step is determine appropriate methods and measurements. Sixth is determine evaluation plan. Seven is collect data. Eight is process data and analyze results. Ninth is interpretation and dissemination of these results. While 10th and last step is applying of evaluation findings. Step one is clarify what is to be evaluated. The purpose of this step is to develop an evaluability assessment with clearly defined goals, population, strategies, activities, output, and outcome. Begin with a clear description of what is to be evaluated. For example, a program, policy, or health communication initiative, so that it can be shared. Consider developing a logic model that includes goals, activities, outputs, and outcome objectives. Second step is engage stakeholders. Purpose is to build support for evaluation by engaging stakeholders. This step involves identifying key stakeholders, understanding their interests and expectations, and engaging them in a review of objectives to develop evaluation questions. Consider making a list of organization and or people with an interest in evaluation. Define stakeholder information needs and intended use of the evaluation. What are stakeholders? The major stakeholders in the healthcare system are patients, physicians, employers, insurance companies, pharmaceutical firms, and government. Insurance companies sell health coverage plans directly to patients or indirectly through employers or governmental intermediaries. In conclusion, stakeholders play a major role in ensuring successful adoption of evidence in healthcare. Their support is necessary because they provide resources, skills, and knowledge that is required for projects implementation. Moreover, they influence the opinion of the public in regard to projected change. Step third is assess resources and evaluability. Purpose of this step is to assess available resources for evaluation and whether the program is ready to be evaluated. Evaluation can be time consuming and expensive. Do an honest assessment of resources to avoid constraints later. Resources includes fund, time, in-kind support, approval processes, for example, ethics, and timeline for implementation and completion. When assessing evaluability, consider whether there is a clarity on the program to be evaluated and why are you doing an evaluation. The evaluation will be useful or not. Leadership buy-in is high and will shape programs. Adequate resources are available and timing is right. Fifth step is determine your evaluation questions. Purpose is to help identify and determine questions to meet your evaluation goals. It involves as many stakeholders as possible to ensure all needs are met. Consider logic model content stage of development, for example, planning, implementation, or completion stage. Evaluations already completed, decisions needed, stakeholders' interests, and resources. Consider this type of evaluation is needed when formative evaluation is typically used in development and planning of a strategy. Process evaluation addresses the extent to which an intervention is implemented as planned and reaching intended population. Outcome evaluation measures a program's success in meeting its goals and objectives. Fifth step is determine appropriate methods of measurement and procedures. Purpose is to identify the most feasible and credible method to use and how data will be collected. Consider when purpose evaluation questions feasibility, data access, reliability of data, who will use data, stakeholder expectations, and what is already being captured. Develop a data collection plan that includes indicators about what to measure and when to collect data before, after, or both. How to collect data, qualitative, quantitative, or both, and from whom to collect data, specific subgroups, representative samples of population of interest. Think about the ethical issues that are involved in data collection. For example, anonymity of data, confidentiality, informed consent, and take appropriate steps. Step 6 is develop a evaluation plan. Purpose is to identify specific evaluation activities, tasks, roles, resource allocations, and deadlines. Evaluation plans detail how programs, policies, or health communication initiatives will be monitored and evaluated, and how results will be used, providing transparency to stakeholders and funders. A data collection matrix can be part of your evaluation plan. A matrix generally includes information that is gathered from previous steps. evaluation questions, and link to logic models if applicable. This includes indicators, methods, data sources, timelines, roles and responsibilities, and how data will be analyzed. That may be an optional step. Seventh step is to collect data. Purpose is to collect credible evidence to answer each evaluation question, results and recommendations that depend upon data quality. Develop data collection tools, survey, interview guide, etc., and procedures and train data collectors. Consider whether incentives are appropriate and brainstorm ways to enhance response rates. To ensure validity, pilot test tools and procedures and closely monitor data gathered. If issues arise, modify tools and procedures and document changes. Computerize data collection to facilitate analysis if appropriate. Eighth step is process data and analyze results. Purpose is to enter data, check quality and consistency of data entry, and analyze data to identify your evaluation result. Implement strategies to review data quality during and after data collection. During data collection, look closely at the first wave of responses and numbers of no response or refusal, and keep data collectors and the evaluation lead connected. After data collection, enter data and double check quality and consistency of entry, sought to find missing high or low values quantitative. Check contents by reviewing transcript details entered, that is qualitative. Organize data in a format that can be summarized and interpreted. Analyze by conducting a statistical analysis of quantitative data. Identify themes in qualitative data. This is a technical step. It enlists expert support when possible. This sets stage for interpretation. Now, step 9 is interpret and disseminate results. Purpose is to interpret and share your evaluation findings, engaging stakeholders so that they can help identify recommendations, anchor the interpretations to the original evaluation questions, create a list of recommended actions that address your outcomes, and use this information to create the materials to communicate your findings. Presentation of findings can take many forms, such as written report, slideshow presentation, and or short informational videos. Tailor what is to be disseminated to their specific interest in the evaluation, and how plan to use the result. Visual aids can be powerful method for communicating evaluation results. Make results available to various stakeholders and audiences. Tailor what is to disseminate to their specific interest in the evaluation and how they plan to use the result. 10th step is apply evaluation findings. Purpose is to use your evaluation results, review recommendations and stakeholders to identify actionable outcomes, and discuss what has been learned from conducting the evaluation. And next steps to incorporate results. Prioritize actions and develop an action plan as a group. Now coming towards the recent advances. This is an article that shows economic evaluation and healthcare and what does it mean. The main points of the article are, this article introduces readers to the purpose of economic evaluation and briefly explains the differences between cost minimization analysis used when the outcomes of the procedures being compared are the same. A cost effectiveness analysis that is used when the outcomes may vary but can be expressed in common natural units such as millimeter of mercury for treatment of hypertension. And cost utility analysis used when outcomes do vary, for example, quality of life scale. And cost benefit analysis that is used when a monetary value is being replaced on services received. Another article is the modeling and the economic evaluation of healthcare, selecting the appropriate approach. This article shows different types of approach, and the main are to provide an overview of the alternative approaches to modeling in economic evaluation, and to highlight situations where each of the alternative modeling techniques should be employed. The main approaches to modeling used in economic evaluation in healthcare are decision trees, Markov models, and individual sampling models. These methods assume independence of individuals within the model. Now coming towards the MCQs. First MCQ is UNICEF have goal to eradicate poliovirus throughout the world in coming years. Many programs have been implemented for this. If in a survey as a physician, you have to report and assess the program activities, the best type of evaluation to be used is option A is impact evaluation, B is process evaluation, option C is outcome evaluation, and option D is formative evaluation.
B.
Process evaluation.
Yes, B is the right answer. This is process evaluation. MCQ number 2 is did the implementation of STD counseling in a community-based organization result in change in the knowledge, attitude, and skills among the members of target population? For this purpose, the type of evaluation that is required is option A is formative evaluation, option B is outcome evaluation, option C is process evaluation, and D is impact evaluation.
D.
B outcome.
Yes, B is the right answer, outcome evaluation. Because this type of questions are asked in outcome evaluation. In impact evaluation, we check the overall result, overall outcome or ultimate goal. Third MCQ is to eradicate dengue fever. 500 people of Faistabad are advised to use mosquito repellents and proper hygienic measures as the target population. To determine the effect of these measures on overall reduction of dengue fever, the type of evaluation that helps is option A is process evaluation, B is impact evaluation, C is outcome evaluation, and D is formative evaluation.
C outcome.
Yes, C is the right answer. This is outcome evaluation because our target population is considered in this MCQ. Outcome evaluation measures program effects in target population by assessing the progress in the outcomes. But if outcome evaluation shows that program did not produce expected results, it may be due to option A is type A error, type 2 error. Option B is impact evaluation issues. C is process evaluation issues, and D is formative issues.
D.
There
It's
are
B.
yes, option C is the right answer, process evaluation issues. Because whenever outcome evaluation is required, we need to do process evaluation before that. As a healthcare worker, a person intends to inject a Sinopharm vaccine to a population above 50 years. To ensure that this program activity is feasible, appropriate, and acceptable before it is fully implemented, is considered in option A is process evaluation, B is outcome evaluation, C is impact evaluation, and D is formative evaluation.
Formative.
Yes, D is the right answer. Formative evaluation is required when ever to check that activity is feasible, appropriate, or acceptable. Option MCQ 6 is the first step in the process of evaluation is to clarify what is to be done. The purpose of this step is to be option A, build support for evaluation by engaging stakeholders. Option B, to help identify and determine questions to meet your evaluation goals. Option C is to ensure validity, pilot test tools and procedures. And option D is to develop an evaluability assessment with clearly defined goals, population, strategies, activities, outcome, and output.
B.
B.
Option D is the right answer. First step is to clarify goals. MCQ number 7 is if a physician need to identify the most feasible and credible method to use and how data will be collected about the patient receiving a Pfizer vaccine. The best step is option A is determine appropriate method of measurement and procedure. B is develop evaluation plan. C is process data and analyze result. And D is to collect data.
C.
Actually, option A is the right answer. Develop appropriate method and measurements and procedures. MCQ number 8 is to interpret and share your evaluation findings, engaging patients, physicians, and governmental organizations so that they can help identify recommendations. Is the main of which of the following step? Option A is interpret and disseminate results. B is determine appropriate method of measurement and procedure. C is develop evaluation plan, and D is process data and analyze results.
D.
Option B is the right answer, that to determine appropriate methods of measurement and procedures. MCQ number 9 is the degree to which a program meets its ultimate goals on an overall rate of STD transmission in a community is also evaluated. It can be best evaluated by which type of evaluation? Option A is formative evaluation, B is impact evaluation, C is outcome evaluation, and D is process evaluation.
B.
Yes,
Impact.
B is the right answer because we need to check ultimate goals. 10th MCQ is scheduled physician or clinic visits, annual rates of food-related hospitalizations along with the asthma emergencies and follow patients of asthma are included in evaluation as option A is patient satisfaction, B is cost program, C is utilization, and D is the salary of physicians.
A.
All these are included in utilization of resources because these are clinic visits and hospitalization of patients. This is the key. These are my references and thank you.